Hello, we are Group 4, and today we will be discussing the links between cognitive decline and air pollution. First, a quick introduction of our team.
My name is Angelo Germani.
I'm Henry Armstrong.
My name is Tarindu.
My name is Shaylin Schultz.
I'm Caitlin Walker.
TJ Owens.
I'm Donald Rutledge.
Here are the 3 articles that we will be focusing on today that were most relevant to the cognitive decline and air pollution.
To summarize our first article, Alzheimer's is a form of dementia that does affect 57.4 million people worldwide and is unfortunately expected to triple by 2050. And the new research from Penn Medical shows that tiny airborne particles, PM2.5, speeds up the damage of Alzheimer's in the brain. They found that by looking at the brain tissue of 600 postmortem individuals with Alzheimer's, they looked at their geographic location and pollution mapping, and they looked at their brain pathology, and they found that people living in areas with higher PM2.5 cause a buildup of amyloid and tau triangles, which are 2 kinds of protein that are common in people with Alzheimer's. Our second article comes from Cambridge. They looked at 300 million people based on the known fact that air pollution is also a risk of dementia, and they found 3 associations with air pollution and dementia, which are PM2.5, nitrogen dioxide, and soot, and all 3 cause inflammation in the brain and oxidate stress, which can worsen the onset and progression of dementia. Third article, there was a study from Emory that looked at adults exposed to high levels of air pollution, and they were at risk for developing Alzheimer's. They looked at 1,113 patients between the ages of 45 and 75 in Metro Atlanta that had positive biomarkers for Alzheimer's, like amyloid. These patients were exposed to ambient and traffic air pollutions at their house. Previous studies from Emory found these associations through autopsies of brains, but this new study shows that adults living currently were younger than the autopsy brains, and they were cognitively healthier. Air pollution does not just raise the risk of dementia, it also makes Alzheimer's neuropathology worse. Just 1 year of higher exposure was associated with measurable effects. And also, the biggest thing, it is hard to directly link air pollution to the cause of dementia since lifestyle choices play a large factor into someone's health, like secondhand smoke, or things like that. But people that are exposed to more air pollution are more likely to develop dementia.
These are the statistics and the numbers to drive home our points. There are 7 million Americans living with Alzheimer's. 1 in 9 people, 11%, ages 65 and older, has Alzheimer's disease. For every increase of 1 microgram per cubic meter of PM2.5, the risk worsening Alzheimer's increased by 19%. A study in England also found that adults had 1.4 times higher risk of developing dementia in areas with the highest annual concentration of air pollution compared to those with lower pollution areas. The evidence suggests a strong link between air pollution and the progression of Alzheimer's disease, highlighting the need for continued research and public health initiatives to mitigate air quality issues. Reducing exposure to air pollution could play a critical role in managing and potentially slowing the progression of Alzheimer's disease among affected individuals.
Contributing factors for 2.5 exposure are loosely defined by the EPA because these particles come in many sizes and shapes and can be made up of thousands of chemicals. And some are emitted directly from a source, such as construction sites, fields, smokestacks, or fires. But most particles form the atmosphere as a result of complex reactions in chemicals, such as sulfur dioxide and nitrogen oxides, which are pollutants emitted from power plants and industries and automobiles. PubMed published research showing that these can be categorized into 12 general sources among 96 global cities, being grouped by these largest sources. And these sources predominantly industrial, combustion and processing, energy transformation and extraction, and residential and commercial processes, as well as other categories such as biogenic VOC, biomass burning, dust, soot, shipping, agricultural, soil nitrogen oxide, and solvents, transportation, and waste disposal. So some of the short-term effects are more widely known than long-term or chronic effects of PM 2.5 on the health and environment that are well known, such as lung disease, respiratory symptoms, asthma, heart disease, heart attacks, and premature death. Impacts to the environment include increased acidity to lakes and streams, the coastal water nutrient imbalance, as well as acid rain effects and disruption to diverse ecosystems. The long-term effects, such as cognitive impairment, memory loss, speech difficulty, and reduced judgment, showing that long-term exposure to outdoor air pollution is a risk factor for the onset of dementia in previously healthy adults. Oxidative stress and inflammation play a well-established role in the onset and progression of dementia. Air pollution is thought to trigger these processes through direct entry to the brain or via the same mechanisms underlying lung and cardiovascular diseases. And air pollution can also enter the circulation from the lungs and travel to solid organs, irritating local and widespread inflammation.
Growing evidence shows that air pollution is not just a respiratory or cardiovascular threat, it's a neurological one. Studies from Emory University and Harvard have linked fine particulate matter, PM 2.5, to increased risk and accelerate progression of Alzheimer's disease. This calls for a shift in public health strategy. Air quality should be integrated into dementia prevention efforts, especially in aging populations. Urban planning also plays a critical role. Research for the Baker Institute and University of Washington highlights how city design through green spaces, low emission zones, and smarter traffic systems can reduce exposure to harmful pollutants and other long-term brain health. Emory recently received a $15 million fund from the NIH. The study aims to cover how acidic pollutants affect the brain, underscoring the need for stronger collaboration between the researchers and policymakers. Together, these perspectives emphasize protecting brain health requires schematic change across public health, urban infrastructure, and scientific innovation.
Right now, tackling air pollution and brain health involves both personal actions and community-wide solutions. On the individual level, people can protect themselves by using air filters at home, checking local air quality apps, and limiting outdoor activities on days when pollution is high. Masks like N95s are also effective on poor air days. At the community level, governments are enforcing stricter emission standards for vehicles and factories and investing in cleaner fuels. And finally, large-scale research and monitoring, like the studies we just reviewed, are helping guide these policies and raise awareness that air pollution is not only a lung or heart issue, but also a brain health issue. Article 3 was a game changer here. It found Alzheimer's biomarkers in the spinal fluid of living, cognitively healthy adults in their 40s and 50s. This means the damage begins decades before diagnosis. This isn't just a problem for the elderly, it's a lifelong exposure issue. There are several alternatives that could make an even bigger impact. First, brain healthy city planning and cleaner energy. That means implementing a smart zoning, expanding electric public transportation, designing cities to be more walkable and bike friendly, and accelerating the transition to renewable energy. Second, prevention. Air pollution starts damaging the brain decades before Alzheimer's symptoms appear. By linking pollution data with health records, we could pinpoint at-risk groups long before symptoms appear. Also, healthy lifestyles like diet, exercise, and good sleep could delay or prevent disease. Preventing disease can no longer be seen as solely the responsibility of healthcare. It's a multidisciplinary effort that must include urban planners, transport officials, and environmental regulators.
In conclusion, air pollution is a known factor in cognitive decline and is expected to only get worse with time. Policies, urban planning, and continued research with diverse populations are needed to help understand and mitigate these health concerns. Thank you, and please add any questions you have to the discussion board.